Here is the latest legislative news from the Texas Hospital Association, April 10th, 2023. For THA, it was a week to repeatedly stand against problematic legislation. And THA membership, THA staff, and THA's written words combined to offer committees detailed descriptions on why myriad bills were so harmful to hospitals. The alarming notion of banning hospital outpatient payments, spelled out in a House bill pulled down last week for reworking, came abruptly roaring back in the Senate with the sudden scheduling of Senate Bill 1275 in the Senate Health and Human Services Committee. THA issued an advocacy alert to its members for the second time in as many weeks, and THA General Counsel Steve Woleb appeared at the Health and Human hearing Wednesday to detail the crushing impact SB 1275, authored by Senator Kelly Hancock, would have. Prohibiting hospital outpatient payments, which cover the entirety of a patient's care aside from a physician's fee, would force clinics across the state to close, decimating access to care. Earlier in the week, Memorial Hermann Health System stepped up to represent THA against House Bill 1973 by Representative Caroline Harris, which would require hospitals to give all patients a, quote, written, itemized bill of charges for all healthcare services and supplies provided, end quote, in order to receive payment. Not doing so would prevent hospitals and providers from pursuing debt collection. Michelle Lindsley, Memorial Hermann's vice president of managed care, said while the hospital and THA support price transparency, HB 1973 would introduce operational and financial challenges for hospitals and confuse patients to boot. Other legislation THA opposed this week included Senate Bill 1534 by Senator Charles Schwertner, which would severely restrict physician non-compete agreements, including a 1-year time limit and permitting a distance of no more than a 5-mile radius. Woleb warned that the legislation would, quote, hardwire arbitrary restrictions on physician non-competes into statute, unquote. THA is working with Senator Schwertner to improve the bill. THA also stood against House Bill 2960 by Representative Briscoe Cain, which would repeal a law allowing a person or entity to provide notice of firearms being prohibited on a property. Woleb told the House Select Committee on Safety about the bill's troubling implications for hospitals and mental health facilities, which, by law, would have a considerably more difficult time keeping a person with a firearm off the premises. There was plenty of legislative action during the week that THA could support as well, in particular when the House Human Services Committee examined THA's proposal of mandatory Medicaid coverage for partial hospitalization programs, or PHP, and intensive outpatient therapy. The THA spearheaded vehicle for that proposal is House Bill 2337 by Representative Tom Oliverson. Chris Bryan, Vice President of IT and Public Policy for Clarity Child Guidance Center in San Antonio, testified for THA in support. Speaking to the impact of PHP on Clarity's patients, Bryan told the committee PHP costs about half of a traditional inpatient stay, and the time children spend at home with their families instead of around-the-clock inpatient stay proves to be valuable. In House floor activity, THA supported legislation on workplace violence prevention moved closer to final passage last week. After House Bill 112 by Representative Donna Howard was placed on the House floor calendar for Wednesday, consideration of the bill was postponed to wait for its Senate companion to catch up, a legislative strategy to ensure quick final passage. That companion, Senate Bill 240 by Senator Donna Campbell, has already passed the Senate and can therefore be taken up quickly in the House thanks to the postponement request by Representative Howard. Both bills would require facilities to maintain a workplace violence prevention committee and train employees on prevention at least annually. SB 240 is one of a few THA priority bills that have passed one chamber thus far. Senate Bill 25 by Senator Lois Kolkhorst, which would help with hospital workforce shortages by offering scholarships and loan repayment opportunities tied to nursing education, has also passed the Senate. On the House side, House Bill 49 by Representative Stephanie Click, a bill to increase hospital investigation transparency, has passed that chamber. Join us again next week for more updates from the 2023 session of the Texas Legislature.